Brad, welcome to the Gravity AI podcast. It's nice to see you again. How are you?
Thanks. I'm doing well. Happy to be here and appreciate the opportunity.
Awesome. Brad, before we get started and get into the world of AI and all the fun things you're doing, would love your introduction for our audience, who you are, what you do, and what's brought you into the world of healthcare.
Sure. So I like to call myself a bit of a weirdo in terms of the normal managed care person, right? So I actually started my career in private equity. I enjoyed that for the time, and then I kind of caught the bug a little bit. We did a little urgent healthcare business out of Arizona, and it just sparked my interest a lot. And I had a good mentor of mine that was like, you really need to get into managed care. And so I ended up leaving private equity and got involved at Anthem, now Elevance, and did that. And then after a good sprint there, ended up in New York. So I was up in New York City with one of the larger health plans in that area and really enjoyed my time there with some really great people. And then in September of 2024, I left to join Longevity. And Longevity is, I would say, my two previous spots were larger health plans with over 1 million members each. And Longevity is very different. We're just under 15,000 members. So, but I think it's something that's passionate. It's a passion of mine. I think I grew up with a sister with disabilities, and I saw how my family kind of navigated the healthcare landscape. And we were blessed in a way that we had resources to kind of navigate that. But at the same time, it really highlighted for me growing up in my childhood how important access to care is, and how certain people within that navigate these type of healthcare dynamics can sometimes struggle to get the care they need, right? And so from a professional lens, it's an interest of mine. I've always been a numbers person, not a letters person. My AP English teacher would have told you that when I didn't do too hot on that. But at the end of the day, like I enjoy numbers. I enjoy math. I find technology fascinating, but it all really only matters if you're making a difference to a person, right? Yeah. And that kind of leads me to where I am now at Longevity. And I think, Longevity is a really interesting business model. So I'm interested to kind of talk about how we get creative with AI there, because it's not your typical managed care environment. Yeah.
So thank you for sharing about your sister. I think it's always wonderful to hear people go through their own lived and shared experiences and how do they channel that into something positive. So it's really nice. And actually, you answered a lot of questions. I didn't realize you were in New York. That explained everything. Your disruptiveness, the innovation. I'm like, that's really cool. Now I get it. Okay, I love New York. So it's one of my favorite cities in the world.
Yeah.
So Brad, you hold two roles at Longevity, which most organizations, I think, they tend to keep apart. One is you run the analytics and you run the clinical delivery. Why does having both matter to you? And what do you see that someone who only holds one misses?
That's a good question. I think, so a couple things. One, me owning the role at Longevity is a little bit of a byproduct of our growth, right? I think in the last 3 years, every year we've grown close to 30 to 40%, if not more. And so really fast growth has kind of led to like just making sure that we find a right spot for things at the right time. But I think one of the biggest things, and I've talked about this previously on other podcasts or different things, is like when you're an analytics leader, one of the biggest mistakes that analytics leaders can make, and I've made it myself, is that you apply analytics and you bring really cool math and you do really great tools, but you don't understand the business at all, right? And so you have an awesome, comp sci degree and background, but like you struggle to understand the actual, what I like to say, and it drives my team nuts when I say this, because I always say it and I do it in quotation marks and they roll their eyes, but it's like how the machine works, right? Like how does the machine of managed care work? What's the business model, right? And I don't just mean, a member enrolls and then they go and get a claim. I mean, you've got bid design, you've got enrollment, you've got eligibility, you've got member engagement, care coordination, authorization, claim, And then after the claim, then you have sometimes the delivery of care. If it's pharmaceuticals, it's a totally other pipeline. And then all of that feeds into the measurement process, which is analytics, your quality scores, everything. And then your quality scores and all of that and your performance impacts what you're able to bring into your next bid. And so it's all a cycle, right? Managed care as an industry is a cycle. And I think when we as leaders lack the understanding of how that cycle works, you can far too often miss the boat in terms of what you're trying to deliver and how it's going to make an impact, right? Because at the end of the day, if you're not, and going back to my introduction, like if you're not making an impact on the ground level where there's actually people doing real work, not to diminish what type of work I do, right? But like it's a service organization. The whole point of analytics, whether you're an analytics company that's supporting a bunch of other organizations doing that kind of stuff, or you're a health plan yourself and you're trying to create a product that works, is you've got to be able to empower the people that are doing the real important work, which is meeting with the members and taking care of the people. And I feel like any managed care business or any payer that loses the sight or loses the mission that the person who's receiving the care, that is your member, is the center of the focus, you can go awry really quickly, right? So I think one of the interesting things with my time up in New York, and it was a really great opportunity, is I actually didn't sit within the analytics organization. I was technically in the clinical operations system. We had just over 200 or just under 2 million members. And of the 2 million members, 250,000 of them, just over 250,000, were dual eligible members, right? And every single one of those people had a care manager, care coordinator. And so I got to experience hands-on in a very operational lens, how enterprise analytics without an operational view can go wrong, and how analytics with an operational view can go really well. And I think that's one of the things that kind of brought to longevity. When I came, I came kind of servicing that specific niche where like we needed clinical delivery kind of connection. And then it's transformed with my time here now with, I'm grateful for the opportunity where now I get to own our analytics. I get to own our medical economics. I get to coordinate directly with our clinical team and make sure that we can turn that into actionable insights and things that are actually useful to them in the field. And even project management, I get to, kind of delegate a little bit and make sure that we're getting proper oversight there. And then I think more importantly and more interestingly, to be honest, is the AI stuff that kind of comes along, right? And that's the cool part with AI, is AI is really, it's like the perfect in between, where if you're making AI that is not actionable and it's not helping the people doing the work, good luck, right? You're not going to get buy-in, you're not going to get adoption, and it's going to fall flat on its face. But if you don't understand the technical lens of how to actually leverage AI or how it's working, you're also at a disadvantage. And I think, frankly, not to skip ahead, that's where a lot of the industry is struggling right now, is when you have these big organizations. The big organizations are struggling with how are you taking AI and operationalizing it, if that's a word, operationalizing. But like, I think that is. And but then like putting it into action in a way that somebody can actually take advantage of it. And then you can get into the technical stuff of like, well, once people actually use something, then you can actually measure for an ROI, right? But you can build the coolest tool ever. If it's not going to get used,
yeah, I'm with you. And I think, where we are as an industry and in the future, I think Brad, you and I have chatted about this before, we have a couple of headwinds, right? One is we have a physician burnout, we have a nurse burnout, we have a growing senior aging population, right? So the infrastructure and the capacity needed to support United States, right? What do we have? For 300 million Americans, we have only around, I would say now, 650 to 700,000 physicians. That is not much, right? And then that's their journey and how many people are getting into that industry and so on and so forth. So I think to your point of operationalizing AI is like, how do we bring that into the workflows where it supports the healthcare workers, right? Whether it's a physician or a care manager, augments them, supports them, and also increases capacity management is the key. And obviously we are in a business, so revenue is definitely a part of that, right? So I'm completely with you that I think, and you also mentioned an important thing about having the the business context is important, right? So I think even when it comes to AI, having the healthcare data context is very important, right? Like from my seat, we've seen enough of companies doing AI and workflows, all these things, but what is the data? Is it born from? Is important. It cannot be just be any data. It has to be healthcare data. It has to be data that's trained and guardrailed and all these other things, right? So I think there is a very sequential way of what does success look like, what does long-term ROI look like, and adoption, obviously. Without adoption, nothing will truly see the light of the tunnel. Um, but from a longevity health plan, it obviously serves one of the most complex populations in the country. Long-term residents of skilled nursing facilities, as an example. For a listener who has never set foot in the world, which I do know it's a very unique place, how would you paint the picture and what makes this population really hard? And Brad, what would you say you really want to be changing, say, in the next couple of years for this population, just from an impact perspective?
So, for any of the listeners that have had a loved one go through being in a facility, whether it was short-term stay or a long-term stay, I'm sure they can relate to the type of setting that you go into, right? And I think it's often really good skilled nursing facilities are going to have an ambiance of care and comfort, and they're going to try to keep it warming. And some of these nursing facilities, you have movie theaters. Some of these nursing facilities, you have great places, right? There's another side of the spectrum, though, where there's also other nursing facilities that are state funded, or they're nursing facilities that are operate on a smaller margin, and they don't have those features, right? And so where we partner in a multitude of types of facilities, and I think one of the things that you often run into is there's often people that go into skilled nursing facilities towards the end of their life in terms of the entire spectrum of their time here on Earth, and they don't have loved ones. They don't have people come and check on them. Or maybe they do have a wonderful family, but their family is far away and their family can't afford to be nearby. One of the beautiful things I think about longevity in terms of the model, right, is traditional health plans usually stay arm's length away because it's a hard monetary thing to manage. If you've got a few members in a facility, a skilled nursing facility, putting somebody in to go and take care of them and treat them bedside, that's just not realistic, right? And so the uniqueness behind our model is we partner directly with the facilities to allow us to place nurse practitioners in the facilities locally. And so we hire local people that live nearby and are credentialed clinicians that are skilled enough and have the highest level credentials where they're able to execute visits. They can actually bill for the visit, and we're allowed to send that data to CMS. It's allowed to flow, right? So it gets into the ecosystem of the model. But that is a clinician that's employed through a clinical services arm that's affiliated and a part of Longevity Health. And what that means is, as the health plan, we're a health plan, but we also have the ability to deliver care bedside to those members. In addition to the clinicians that we employ, we also employ member advocates. And member advocates are people that are not clinicians, but they help augment and supplement that time there. So they'll go in and they'll run events, or they will. We have a wonderful partnership with SingFit, and we help administer music therapy in the facilities. And so the goal there is we really want to enrich the members' lifestyle and the members' experience while they're in the facility. Sometimes when they're at their most vulnerable state, we're able to meet the member where they are, and we equally get to treat them bedside. So, if somebody's feeling sick, if they traditionally get out of bed at 10 a.m. and we realize they haven't gotten out of bed that day, we know the member that well because we're in there in person on a weekly basis. We might notice that. We might be able to talk to them, and maybe we can prescribe something that our NPs can assess and say, oh, they have a UTI. Maybe if it would have gone unaddressed, it would have resulted in an inpatient stay, right? And then you've got to go through forget the dollars, right? But let's focus on the experience. Again, going back to having loved ones, I've had three of my grandparents, and my last living one is in a facility now. The experience of falling and going into an inpatient stay at a hospital, the ambulance ride, going into a place you're not familiar with, especially if your memory isn't where it used to be, that's rough. That's a hard experience to go through, and there's studies that show, it slows down PTOT, it slows down recovery. It's tough.
Right.
And so when you're able to treat bedside, not only are you having a positive impact from a business lens because you can avoid an avoidable expense,
Right.
you're also able to treat the person like a human and help them avoid a potentially disruptive experience, sometimes when they're most vulnerable. So I think that's what's really rewarding about it. We even, when I focus on enrichment, the one other fun thing we've done, and I can't miss this plug because it's a cool one, is we started a new supplemental benefit this year called the Life Enrichment supplemental benefit, and what it does is, like, you can get certain things you might need from the store and different stuff. But the cool part is when we start looking at, and this is the nerdy part of Brad coming out because we've talked about this, right? Is like you have like the heavyweight dolls that you can get. We have like robotic dogs, robotic cats. So like they'll sit there and you can pet them and they're weighted and they'll react to you and the cat will purr. You can feel, and I thought it sounded cheesy, right? I was like, oh, like a robotic cat. No, like I went into the office in Palm Beach and there was a cat like sitting there, and it's like a little like bed that the cat's sitting on, and I touched it and like I could feel it vibrate. I was like, whoa, this is actually really it's a really cool thing. But it's something that somebody who's lonely and somebody that otherwise wouldn't get to have a companion can have something like that. That's just, and it's extra, but it's something we get to offer through the model.
Yeah, I can see, you have your heart in this. I can, just see that with the tone and the way you're showing up. It's really great. And I think, as you're mentioning, I was just like thinking about obviously the senior aging population, but we, especially in the United States, we do have a high risk of loneliness, isolation, even among the youngest of the young people, right? Because the sense of community is so less. So I think concepts, though, we don't want to go to full state of autonomy in these things, but robots and cats and dogs and all these things are just, they're good, right? My dad, he's almost 80, right? Sometimes he's talking to Claude AI and he's just chatting away. He's intellectually very, very stimulated. And he's like, this is a great friend. But it's just, at the end of the day, we all just need someone to talk to, ideate, have company. And and I think the work you're doing also reminds me that end of the day, what matters for each human is to have a sense of dignity.
Absolutely.
When they're alive, when they, to the end of life, right? And how do we actually enable and make that happen is really, really hard, especially in a country like United States. Like in India, I remember like every time, there's like a bunch of people come to the house, right? So the sense of loneliness and community and leaning on is a little bit of a different economic and existence model than the United States. So I think it's really incredible the work you're doing, but it's also really, really hard work, But so thank you for doing that. Moving gears to AI, because I know we've spoken quite a bit about this. What are you excited about in AI today, and what are you kind of skeptical about in AI today?
There's a couple things I'm really excited about. I think from a total like boring AI is like a new thing. I'm going to make it a thing, I swear. So like it's when the idea of boring AI is when it's something that like the product of it is completely not flashy and it's not AI and people don't know it's AI, but it is so cool because it gets something done that nobody wants to do. And so one of the things is like cursor control technology to me is like really cool, where you're seeing companies like they're doing like virtual desktops, they're standing up in the cloud and they're able to like control the cursor on a desktop and go and execute something somebody would do. I think that is really interesting because especially in healthcare, there's so many legacy systems that are just broken. And it's one of those things, especially with how intertwined the federal government and state governments are with the model, right? That you're going to get these systems that if you sit and you wait for a software update that's going to fix everything, you're not going to get anywhere, right? So like the cool thing is like, how can the technology meet us where we are? And I think that a lot, like the capability to have an agent actually control a computer and do certain things that are otherwise very manual without where you wouldn't otherwise have an API or you wouldn't have anything like that. I think that's the boring stuff, but it's also kind of cool because you're almost reversing it, right? Instead of doing something really cool and breaking edge, you're doing something really boring, but you're doing it with cool technology.
Yeah.
So that would be one thing. I think when we get more into the cool and flashy stuff, because that's the fun stuff too, is when we talk about member experience, I think one of the really interesting things is going to be more augmented, personalized experiences that are digital. And so whether or not that means, and we've talked about this, right? Whether they're talking to what looks like a person, but it's not a person, or whether they're simply navigating like a page. I think one of the cool things is with AI becoming a little bit more economic and some of these models being more cutting edge, but they're cheaper, like a haiku model or something like that. You could have somebody's metadata stored away as a user, and then the second they load a page, the page could be completely personalized based off of their preferences.
Right.
Now you're using AI to do that, infer, right? But when you load a page, what one member sees may be completely different than what another person experiences, where otherwise to program that would have been completely unrealistic, right? And so there's really cool personalization concepts that are coming up that I think we have barely scratched the surface of as an industry. I think the other thing that I would say, just to kind of highlight in terms of that I'm skeptical of, and it's more of a problem, but it's interesting. So for the first time, I was in Chicago meeting with a group of people talking about AI and different things, and it kind of came up for the first time in over 2 decades.
Mm-hmm.
The providers are ahead of the payers in terms of technology, right? And what's happening is the providers are smaller,
Mm-hmm.
they're quicker,
Mm-hmm.
they have less hoops to jump through,
Right.
and what we're finding is they're able to implement solutions much more quickly than larger organizations.
Mm-hmm.
And that really hasn't been a problem because you've usually, up until now, before AI, like the barriers of entry to do more complicated technology like machine learning, you wouldn't expect a small PCP practice to drive a machine learning model, right? But now that's not, using AI, the barriers of entry are so much smaller than what they've been historically for other technologies.
Right.
It's been a really interesting about face. It's created a really fascinating dynamic in terms of rates and in terms of med expense. You're seeing the term is, and it was the first time I heard of it, it's like claim intensification, right? So claims intensification is the concept that it's not upcoding because it's accurate. It's not it's not false. It's not fraud, waste, and abuse. It is a optimization on a massive scale of claim accuracy that is driving a significant change in the industry because the accuracy and all these systems are being fine-tuned really quickly and really natively to optimize the claim in a legal way to maximize cost, right? So the orders of the DRGs, the orders of certain diagnoses codes, like for a PCP visit, 99306 is significantly less than a 99309, right? But what happens is if you have an AI bot that knows how to go and document all of your clinical justifications to bill a 99309,
Right.
And you just have to click a button and you don't have to sit there and spend 30 minutes to do it, you're going to be able your documentation is so much higher because it's all generated by AI, right? So what ends up happening is now you have health plans that are receiving an increase in, not in claim volume, but an increase in claim optimization,
Right.
and their medical costs are ballooning, and rates haven't caught up yet.
Right.
And the health plans haven't caught up from a technology lens. It's a really interesting dynamic that is just kind of, it makes you pause because the industry hasn't quite gone through that yet.
Yeah, I was just thinking about the whole claims intensification because I'm like, we are still not much at a stage, even in providers and so much in payers, to just stabilize before we optimize. So it's interesting that the focus gone to the other side than
Mhm.
the, on the backward side. But here we are. Who knows?
Exactly.
As long as it works and patients get what they need, I think that's great. But if not, we got to check that out. I'm curious. So within longevity, we've spoken quite a bit of AI and predictive modeling, analytics, machine learning, all these things. When you think about AI and its ROI, and the top three areas where you really think you would want to be implementing AI, what would that be, and how do you define ROI internally in those areas?
So I would categorize it in a couple different areas. I'd say I'm going to answer your last question first, and then your first question last. ROI can be measured in 2 to 3 different categories, right? The most common is an ROI that's measurable on a P&L. I think for AI, that's the hardest type of use case to find,
Right.
too, right? Is often something that's measurable on a P&L assumes that it has received action. It assumes that people have adopted something and followed a process for a long time. Um, and it often assumes that it's a retroactive kind of like
Right.
change or shift.
Right.
And so I think down the road,
Hmm.
that's very impactful. But what's more often and what's more likely with AI is going to be something that's a little bit more in the middle. I like to call it, it's more of the cost avoidance kind of thing, right? So, and I differentiate those things like a cost savings and a cost avoidance are two very different things.
Hmm.
Cost savings is like, we had this, it's clear, it's on paper, we know we saved these dollars, we had this claim, it shouldn't have been paid, we got it back, and boom, 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 and you're done, right? And you recoup the dollars, and you're clean, and you save money. That's cost savings. A cost avoidance is we have a group or a portfolio of members and a panel of members in a single building, and we know that the building has in the past had psych providers that will cycle through and prescribe psych medication.
Hmm.
We also know that some of these members have had recent inpatient stays, and they may have gotten other types of prescriptions during their inpatient stays, and now they've returned back to the facility. It's very possible that that member's panel or that member's formulary may have conflicting medications, right? And those conflicting medications could cause dizziness or could cause things where there's a fall, could cause other issues for the member that we aren't aware of, right? AI is a really good tool to review a member's list of active prescriptions and then say, hey, wait a minute, like this dosage of this and this and this, they could have, otherwise you're hiring a pharmacist to go back and review everything, and it's just hard in terms of scale, right? So you wouldn't want to have the AI go and do stuff, but AI would be a great tool to kind of alert a pharmacist or an NP and say, hey, please review these prescriptions. Something doesn't seem right. What would happen is you could potentially avoid a fall, right?
Right.
If they go in and they fix it. Now, how do you measure ROI on that, right? You could argue that an inpatient stay is roughly $15,000,
Right.
or you could, but you're not going to see it. It's something you never saw, right? It was going to come, you never saw it, you avoided it. Did you
Right.
save up? Did you save money? That's going to be a constant
Right.
debate, right? Across managed care. You go ask 5 different Medicon teams, half of them are going to say one thing, half of them are going to say another. Same with execs, right? And so those things are really good. I think that's where AI sweet spot is. And
Right.
what you can do is like over time, you'll have a trend,
Right.
right? But also the other tough thing is like, and it's the elephant in the room, right? Is like AI is not particular. People aren't like the tech people are like, oh, AI, right? But like it is, there's a mix of opinion on AI. Like some people are comfortable with AI, some people aren't. And especially when you go and you talk to a CFO or you go, and like luckily longevity, our CFO is very open to it. But like when you talk to certain finance folks, like if it's not a hard savings, but it's going to cost money and it's a
Right.
questionable technology and you're not quite sure. And by the way, 82% of AI pilots last year failed.
Hmm.
We'll get into that
Yeah.
later point. But like if that's the case study, there may be pause. right? And then it comes into like, well, what are the leaders that are kind of driving this type of technology doing to make sure that it's going to be a successful pilot? I think that's that's the most popular area, and I think that's why you're seeing a delay, especially on the side where there's stakeholders and you've got a board that you've got to respond to, and you've got to justify the spend and all this stuff. You're seeing kind of a hesitation.
Right.
And then you've got savings that are absolutely soft. It's like, well, go ahead and tell me how much it's going to save. If I can give a clinician a clinical best action GPT that knows how to handle certain scenarios, how do you assign an ROI to that, right? Or an ambient scribe technology that you give a clinician and they can speak into it and it summarizes their clinical visit. Like, that's much harder. And you could come up with an administrative savings and stuff, but that's not just administrative, right? There's going to be premium savings that come into play because you have better documentation. There's an entire scope of optimization that comes from that, but it takes time, sometimes years, with the way that our model works. Going back to the cycle I was talking about, right? It could take years to really find its sweet spot. And so, it's a complicated way, and I think the healthy way that organizations should look at it is they should pick a portfolio of initiatives. You want a couple quick wins that will hit your P&L. Those are harder to find, but I think they're going to be usually a little bit less. But a good example, your sweet spot's in the middle, and then your long pole in the tent is going to be some of the stuff that addresses exactly what you were talking about when it came to clinician burnout and different things. What are things that are going to address the clinician burnout? What's going to reduce your turnover rate? What's going to make people feel more equipped to operate at the top of their license versus them being an administrator behind a screen all day when they went to school to be a nurse practitioner, right? Or to be a nurse.
And I think I love your answer, and I think you're very strategic, and you can get tactical too. See, to me, in the world of healthcare, I feel like, yes, numbers are important. CFO, P&L, we all have this, but I think there has to be a qualitative ROI as well, right? There are buckets where I talk about, yes, the hard ROI. Where am I putting in AI? What is the revenue I'm generating? All of that is important. But at the same time, having a little bit of tier saying direct, indirect impact on my patient experience, on, say, the senior living population. Are they happier? Did the care manager show up in the right time at the right place, giving the right care? Do they have the right details? What is the time that was saved? With the care management now working 10 hours seeing 50 patients at a better quality versus working same number of hours seeing 20 patients at a poor quality. Like, those things matter, because I feel like though the attention may be going to that, but drawing that benefit analysis to the long-term game of revenue, there is a ripple effect, right? Like, we can't forget the underpinnings of this and then say, this is one thing, then the numbers aren't a thing. They are interconnected, right? And I think the places where I've seen them stitching this together are when the CFO, the CMO, the CIO, they all come to the table and say, these are my ROI different buckets of table. How do we map this out? And then what does an AI, not cost, investment look like? And what are the buckets do you want to invest in to start scaling? Obviously, crawl, walk, run, all that stuff, right? But I think when we don't have that buy-in at a leadership level, and it's taken as an IT project versus not a complete enterprise kind of a investment for the future holistic growth, it becomes a problem. You've said before, building AI literacy is central to the future of managed care. In my experience, the model is rarely the hard part. Getting people to trust and use it is. How are you navigating through that? What are your strategies for change management?
Every answer I'm giving you is like a 3-step tier. And I'm just realizing that I'm not meaning to do that, but this answer is also kind of a 3-step. Maybe that's how my brain works. I'm just realizing that now.
The podcast title is the 3-step process to success.
There's going to be a lot of 3-step processes.
Great. I mean, great. You could think clearly. Yeah.
No. So the way I look at it is like, you've got 3 groups of people with AI, right? You've got, I'd say, maybe 20 to 30% of your staff, and it probably varies based off of the staff, but I'm talking more technical people, right? Analysts, developers, stuff like that. 20 to 30% are jumping at the bit. Yeah. They love it, right? And they're all about it. and they're willing to learn it on at night. They're playing with it. They've got their own stuff. They've got their own Claude bot, whatever they're running on the side, right? And they're super excited and they love it. Those are the people you want to really empower, to give them the tools, let them go and run and try with the new fancy stuff, right? They know how to develop prompts. They understand triggers. They can do webhooks and they can set up stuff that's just exciting for them, right? The majority of the people, I'd say, fall into the second group, which is more like the 50%. And I'd say the 50% of these people are, they're not anti-AI, but they're kind of cautious a little bit. They maybe are intimidated by it. And they may feel a little bit like it's completely outside of their wheelhouse, or they don't know how to break into it. Similar to when people shifted into computers, right? It's not that they were against it, but they were just like, I don't really know how to do this. And I think it's one of those, it's like a bike. Like you just got to try at some point. You can read as much as you want about how to ride a bike, but until you jump on the bike and try, you're not going to be able to do it. And so you just have to get some practice swings in, and you need to encourage them. And frankly, I think as leaders, it's our job to empower people with the right tools and with the right direction and with the right opportunities to use this kind of technology and get to a good place with it and realize its value. I think it can drive different types of value in many different ways. And I think the easiest part, of course, is start with like administrative use cases, right? Like give them Opus and tell them, hey, go talk to Claude and figure out how, you want to run this report, or give it this report and ask it a question. It'll give you an answer instead of you having to sit there and figure it out yourself, right? So I think there's that. And then there's the last group. And the last group's like the last 20 to 30%. And these are people that are, maybe in their personal life, they don't want to use AI at all. Maybe they look at it as a threat and it's going to get rid of their job. Or they think it's going to be something that they think it's always wrong because in 2023 and 2024, AI went through a stage where it was hallucinating, right? Where it sounded really smart, but then you read it and then it was like nonsense, right? Yeah. I think those are the harder eggs to crack, right? I think those people, I think it's important to note they are absolutely entitled to have their opinion, especially when it comes to their personal life and how they want to use it. I've got family that falls into that boat, right? They have zero interest. And I think it would be inappropriate as leaders to push that on people in a personal setting. I do think, however, there is a balance, and it's important for us to do it in a professional and fair way. But there's certain scenarios eventually, if somebody insists on writing everything by hand, and all of their peers are typing on a computer and they're 5 times as productive. Right. What ends up happening is that last group they're not creating poor quality work, right? It's not a reflection of their quality. It's a reflection of their efficiency. Right. And at the end of the day, AI is just a tool. It's not a silver bullet. It's not going to, do anything crazy that humans can't do. It's an accelerator. Right. And if 70 to 80% of the workforce ends up using it, which I firmly believe over time, 70 to 80% of the workforce will use it. I do still think 20% of your folks are probably going to be super users. And then you're going to have the big chunk of your folks that are going to they'll use it the way you've given them guidance, and they might come up with ideas. It just won't be as accelerated as that first group. You're going to struggle, and that last group's going to struggle eventually because they're just going to get behind and they're not going to be able to keep up with their peers. And I think it's going to hit analytics first. People that can sit there and want to manually type a SQL query, I'm sure they can write really great SQL queries. But in the same time, you're going to have somebody, run a super complex Python script that does 10 times more than what they were able to do in the same time period. And so it just comes down to speed. Right. And it's going to be really interesting to see. But I think the biggest thing is leaders need to give people opportunities, and they need to encourage their staff to make mistakes, and they have to give them safe playgrounds where they can make mistakes and sandboxes and encourage the use. Yeah.
Love the answer because I was just like thinking how many people are not adapting AI. I think that's quite a bit. Some people are doing robots, they're in space. You know, we have different spectrums of people doing different things. But I think my favorite quote I was thinking was like, resistance is more painful than change. And we are globally at a place where we have to change. There is no like, it's not a place to have a discussion or a question anymore. Like 3 years back, you and I were not discussing agentic AI, right? I don't know if they even existed, right?
Right.
Now we're already getting to humanoid robots and all these other things. So it's almost like think reframing humanity as how do we quickly adapt change as innovation happens at the speed it's happening. It's not easy. But sitting back and saying I'm not going to do it is a very hard, kind of seat to be sitting in. But Brad, this brings us to our last question. 3 takeaways for the future of AI. What would that be?
Oh man, 3 takeaways for the future of AI. I'll get the easiest one out of the way, and it's just a repeat of what we just went over. Is like if you're a leader and you are in a position of leading people, and you are not giving your staff an opportunity to learn, or you yourself are not learning, you're not just doing yourself a disadvantage, you're doing your staff a disadvantage. And so you have to be empowering the people that work underneath you. I call that like an entrepreneurial leader style, but like you've got to lean in. And if your absence of trying is impacting your staff that your job is to empower, really strongly recommend you look at that. I think number 2 is governance is important. A wild, wild west of AI is a really bad thing for AI. And it's bad because a lack of governance can lead to mistakes. And it's fascinating. And there's loads of studies out here, so I don't need to cite any of them because you can go and Google it and you'll find them. Or ChatGPT it. I don't know why I said Google. Is, I think like mistakes by AI are so much highly scrutinized, are being scrutinized at such a higher level than mistakes by a human. Mistakes by a human happen every single day, everywhere, right? And it's just like, oh, well, we're human, right? But the second AI makes a mistake, it's like, oh, AI made a mistake, lock it down. And so, like, we've got to be careful if we're leading the way on implementing AI, whether it's today or 5 years from now. We've got to make sure we're following a governance track that puts guardrails in place, not red tape, guardrails.
Right.
No speed limit on the highway, but you got to drive on the road, right? And I think as long as we, as leaders, make sure that we're following a governance structure, NCQA has some of those out. We're starting to see some of it come out in terms of federal guidance. And if you're behind in that, highly recommend, like whoever's listening, catch up on NCQA's guidance. It should be coming out this week. This is July 10th of 2026. So like it should be coming out. We're supposed to see more. We need to keep up with that because if you're going down one way and all of a sudden guidance comes out and you don't catch up, you're in a bad spot. So stay on top of governance, empower your employees. And I guess the cheesy answer, but the real answer is like, don't forget, it's not about the money. Like AI will give opportunities, right? But like the best way to use this kind of technology is when it's going to make a difference for a person at the end of the day. And I think, again, going back to how the machine works, so full circle, we've got to understand if we're putting in a change anywhere. And this is for whether you're an operator that's doing AI or an operator doing something non-AI. You've got to understand how your changes within an infrastructure of a managed care plan that manages thousands and thousands of members and lives that depend on their healthcare. You've got to understand how the change you're putting in is going to impact and trickle down and waterfall to where you're going to go. And so I think there's loads of opportunity with AI. There's also loads of opportunity to make a mistake. And so it's important that we are cautious. It's important we do our due diligence. It's important we implement things not in a tunnel or in a funnel, or a silo, but like collaboratively with partners, and you bring people along. And I think if you do those things, we're going to be in a good spot as an industry.
Love it. Brad, thank you so much for your time, insights, and obviously the incredible work you do. But this is a wrap. Thank you for being part of Gravity AI podcast, and thank you all for listening.
I appreciate it. Thanks.